Hello everyone. The topic for this session is base of the skull. The objectives are to learn about Norma basalis, the bones and foramina present in the Norma basalis, the attachments and the structures passing through the foramina. The Norma basalis can be studied by dividing it into three parts. The anterior part, which is formed by the hard palate and the alveolar arches. The middle part between the hard palate and the imaginary line passing through the anterior margin of the foramen magnum, and the posterior part which is behind the anterior margin, that is line passing through the anterior margin of the foramen magnum. The anterior part of Norma basalis, it includes the alveolar arch which bears the sockets for the roots of the upper teeth. The hard palate, it is formed by the palatine process of maxilla which forms the anterior 2/3 of the hard palate, and the horizontal plate of palatine which forms the posterior 1/3 of the hard palate. So, between these two there will be a crisscross suture. So, these sutures are the intermaxillary suture which is present between the palatine process of maxilla, the palatomaxillary suture that will be present between the palatine process of maxilla and the horizontal plate of the palatine bone, and the interpalatine suture that is present in between the horizontal plates of palatine bone. The dome is arched in all directions and shows the pits for the palatine glands. The incisive foramen, it is a deep fossa situated anteriorly in the median plane. Two incisive canals, right and left, pierce the walls of incisive foramen. The greater palatine foramen, one on each side, situated just behind the lateral part of palatomaxillary suture. So, a groove leads from the foramen towards the incisive fossa. The lesser palatine foramen, 2 or 3 in number on each side, it lies behind the greater palatine foramen. The posterior border of the hard palate is free and it presents the posterior nasal spine in the median plane. And the palatine crust, it is curved ridge near the posterior border. It begins behind the greater palatine foramen and runs medially. The attachments in the anterior part, along the posterior border of the hard palate, the palatine aponeurosis is attached, and to the palatine crust the tensor velae palatine is attached, and to the posterior nasal spine the musculus uvulae is attached. Now, the middle part of Norma basalis. So, it extends from the hard palate anteriorly and the imaginary line passing through the anterior margin of the foramen magnum posteriorly. So, here also we can read by dividing it into median area and the lateral area. In the median area, it shows the posterior border of the omer. It separates the two posterior nasal apertures. Its inferior border articulates with the bony palate and the superior border splits into two. Then the palatovaginal canal. The inferior surface of the vaginal process of medial pterygoid plate is marked by an anteroposterior groove which is converted into palatovaginal canal by the upper surface of sphenoidal process of palatine bone. The omerovaginal canal, the lateral border of each ala of the omer comes into relationship with the vaginal process of medial pterygoid plate and may overlap it from above to enclose the omerovaginal canal. So, in the median area there is a broad bar of bone which is formed by the fusion of the posterior part of the body of the sphenoid and the basilar part of the occipital bone. So, it presents a pharyngeal tubercle a little in front of the foramen magnum. So, in the medial area we have seen this, that is the broad bar of a bone, then posterior end of the omer and the palatovaginal canal and the omerovaginal canal. In the lateral area, it is formed by pterygoid process and the greater wing of the sphenoid bone. The lateral pterygoid plate, that is the pterygoid process, it projects downwards from the junction of the greater wing and the body of the sphenoid behind the third molar tooth. So, inferiorly it divides into lateral pterygoid plate and the medial pterygoid plate. So, these are separated posteriorly by the V-shaped pterygoid fossa. So, the medial pterygoid plate is directed backwards. It is having a lateral and medial surfaces and the free posterior border. The upper end of the posterior border divides to enclose a triangular depression that is called the scaphoid fossa. So, the arrow mark showing the triangular depression that is called as the scaphoid fossa. And the postero-inferiorly, that is the lower end of the posterior border, is prolonged downwards and forms the pterygoid hamulus. The lateral pterygoid plate, it is directed backwards. It is also having the medial and lateral surfaces which gives the attachment to the muscles. The posterior border sometimes has a projection at its middle called the pterygospinous process. The infratemporal surface of the greater wing of the sphenoid is pentagonal. So, the posteromedially it shows a projection called the spine of the sphenoid bone. So, along this border we can see the foramen ovale. It is the large foramen and it is oval in shape. Because of that it is named as foramen ovale. The foramen spinosum, it is a small and circular in shape situated posterolateral to the foramen ovale. Then sulcus tubae, it is the structure which is present between the petrous temporal bone and the greater wing of the sphenoid bone. The petrous temporal bone, it is that is the inferior aspect of the petrous temporal bone. It is projected downwards. It is triangular in shape and the apex is directed forwards and medially. Anterior to this, that is, here we can see the greater wing of the sphenoid bone and the base occiput. So, the petrous temporal bone, which is triangular in shape, lies between the greater wing of the sphenoid and the base occiput. Anterior to that we are having the foramen lacerum, which is irregular in shape, and in the posterior aspect of the petrous temporal bone we can see the carotid canal. The tympanic part of the temporal bone, it is called as the tympanic plate. It is triangular curved plate which lies in the angle between the petrous part of the temporal and the squamous part. So, its anterior surface forms the posterior wall of the mandibular fossa and its posterior surface is concave and forms the anterior wall, floor and the lower part of the posterior wall of the external acoustic meatus. In the squamous part of the temporal bone, it is having the anterior part of mandibular articulating surface which articulates with the head of the mandible, and the articular tubercle is present which is continuous with the anterior root of the zygoma. So, in the median area we have seen the median part, in the middle part we have seen the median area and the lateral area. So, now the attachments of this middle area. The pharyngeal tubercle gives attachment to the upper fibers of the superior constrictor muscle. The longus capitis is inserted lateral to the pharyngeal tubercle. The rectus capitis anterior is inserted little posterior to the and medial to the pterygoid, the hypoglossal canal. So, the lower part of the posterior border of pterygoid hamulus gives origin to superior constrictor of the pharynx. The pharyngobasilar fascia is attached below to the processus tuberis. The pterygomandibular raphe is attached to the tip of the pterygoid hamulus. The lateral pterygoid plate, the lateral surface gives origin to the lower head of the lateral pterygoid muscle. The medial surface gives origin to the deep head of the medial pterygoid muscle. The infratemporal surface of the greater wing of the sphenoid gives origin to the upper head of the lateral pterygoid muscle. The spine of the sphenoid is related laterally to the auriculotemporal nerve and medially to the cauda tympani nerve and the auditory tube. Its tip provides attachment to the sphenomandibular ligament, the anterior ligament of malleus and the pterygospinous ligament. The tensor velae palatini, it is attached to the anterior aspect which that is anterior aspect of the spine of the sphenoid, that gives the attachment to the tensor velae palatini and the tensor tympani muscles. The levator velae palatini, that is inferior surface of petrous temporal bone, gives origin to levator velae palatini. So, now the posterior part of the norma basalis. So, here also we can study under median area and the lateral area. So, in the median area it shows the foramen magnum. It is the largest foramen of the skull. It opens upwards into the posterior cranial fossa and downwards into the vertebral canal. It is oval in shape, that is broader in broader posteriorly and narrow anteriorly. The external occipital crust, it begins at the posterior margin of the foramen magnum and ends posteriorly and at the external occipital protuberance. The external occipital protuberance, it is a projection located at the posterior end of the crust. The nuchal lines, the superior nuchal line begin at the external occipital protuberance and the inferior nuchal lines at the middle of the crust. Both of them curve laterally and backwards and then laterally and forwards. In the lateral area of the posterior part, we are having the condylar part of the occipital bone, the styloid process, the stylomastoid foramen at the junction of the styloid process and the mastoid process. The squamous part of the occipital bone, which is marked by the superior and inferior nuchal lines as mentioned earlier. The jugular foramen, which is the large and elongated foramen placed at the posterior end of the petro-occipital suture. The condylar part of the occipital bone, it is oval in shape and is situated on each side of the anterior part of the foramen magnum. In front of it, there is a canal known as the anterior condylar canal, also known as the hypoglossal canal. And one more canal is situated posterior to the condyle, that is called the condylar canal. The mastoid process is situated on the more lateral aspect and it is showing the mastoid notch. The attachments of the posterior part. The anterior atlanto-occipital membrane is attached anterior part of the foramen magnum. The posterior atlanto-occipital membrane is attached on the posterior aspect of the foramen magnum, and the alar ligament is attached on the roughened area surface of the on either anterior aspect of the foramen magnum. The rectus capitis lateralis is inserted into the inferior surface of the jugular process of occipital bone. The ligamentum nuchae is attached along the crust, external occipital crust, and also the occipital protuberance. The area between the superior and inferior nuchal lines provides insertion medially to the semispinalis capitis and laterally to the superior oblique muscle. The area below the inferior nuchal line provides insertion medially to the rectus capitis posterior minor and laterally to the rectus capitis posterior major. And the posterior belly of digastric is attached along the mastoid notch. So now we will see the structures passing through the foramina in the Norma basalis. So through the incisive foramen, the greater palatine vessels and the nasopalatine nerve passes, and through the greater palatine foramen transmits the greater palatine vessels and anterior palatine nerve. Through the lesser palatine foramen, the middle palatine nerve and the posterior palatine nerves passing through the lesser palatine foramina. The palatovaginal canal transmits pharyngeal branch of pterygopalatine ganglion and the small pharyngeal branch of maxillary artery. And if sometimes the omerovaginal canal, if it is patent, it also transmits the branches of the pharyngeal branch of pterygopalatine ganglion and the vessels. The foramen ovale transmits the mandibular nerve, accessory meningeal artery, the lesser petrosal nerve and the emissary vein. So mnemonic you can remember MALE. Through the foramen spinosum, the structures passing through are middle meningeal artery, the meningeal branch of mandibular nerve, also known as nervus spinosus, and the posterior trunk of the middle meningeal vein, 3 M's through the foramen spinosum. through the foramen lacerum. Usually it is during life the lower part of the foramen is filled with cartilage and no significant structure passes through the whole length of canal except the meningeal branch of ascending pharyngeal artery and the emissary vein. Through the foramen magnum, the apical ligament of dens and the vertical band of the cruciate ligament. So, these two are passing through the narrow anterior part, and one more structure in this is the membrana tectoria. Through the posterior wider part, there will be lowest part of medulla oblongata and the 3 meninges. So, within the subdural space, the structures found are the spinal accessory nerves, vertebral arteries, sympathetic plexus around the vertebral arteries, the posterior spinal arteries and anterior spinal arteries. Through the hypoglossal canal, the hypoglossal nerve and the meningeal branch of hypoglossal nerve, meningeal branch of ascending pharyngeal artery and the emissary vein. Through the posterior condylar foramen, the emissary vein passes, and through the jugular foramen. Through anterior part, the inferior petrosal sinus, the meningeal branch of ascending pharyngeal artery, and through the middle part, the 9th, 10th and 11th cranial nerves, and through the posterior part of the jugular foramen, the internal jugular vein, the meningeal branch of occipital artery. So, passes through this foramen. Through the stylomastoid foramen, the facial nerve passes. Thank you.